Before we begin, this video is general health education, not personal medical advice. Fiber is a plant-based substance that plays a crucial role in digestion. It's a type of carbohydrate found in whole grains, nuts, seeds, fruits, and vegetables. There are two main types: soluble fiber, which dissolves in water, and insoluble fiber, which doesn't. Soluble fiber helps regulate blood sugar and cholesterol levels, while insoluble fiber adds bulk to stool, aiding digestion and preventing constipation. Most people don't consume enough fiber, but gradually increasing intake can support digestive health. Fiber comes in two types: soluble and insoluble. Soluble fiber forms a gel-like substance in your gut, slowing digestion to help control blood sugar and cholesterol levels. You'll find it in oats, beans, and apples. Insoluble fiber adds bulk to stool, keeping your digestive system moving smoothly. Think whole grains, nuts, and carrots. Both types work together, but most people don't get enough of either. When you eat fiber like from oats or beans, soluble fiber forms a gel in your stomach, slowing digestion and stabilizing blood sugar. Insoluble fiber adds bulk to stool, keeping things moving. In your colon, gut bacteria ferment soluble fiber, producing short-chain fatty acids like butyrate. These nourish colon cells, support digestion, prevent constipation, and maintain a healthy gut environment. Eating a variety of fiber-rich foods like whole grains, nuts, fruits, and vegetables does more than just increase your total fiber intake. Different fibers work together to support digestion and gut health. For example, soluble fiber in oats slows stomach emptying, helping stabilize blood sugar, while insoluble fiber in carrots adds bulk to stool, preventing constipation. These fibers also selectively feed beneficial gut microbiota, producing compounds that strengthen your digestive system. Fiber isn't just about digestion. It can also help with weight management by making you feel full faster. This happens because fiber adds bulk to your meals, which signals your stomach that you're satisfied, even if you've eaten fewer calories. For example, whole grains and nuts contain soluble fiber that slows stomach emptying, keeping hunger at bay longer. However, adding too much fiber too quickly can cause gas, bloating, or cramps, so it's best to increase your intake gradually. While fiber supports weight control, it doesn't replace a balanced diet or regular exercise. Fiber isn't just about digestion, it also plays a key role in heart health. LDL cholesterol, often called bad cholesterol, can build up in your arteries and increase the risk of heart disease. On the other hand, HDL cholesterol, or good cholesterol, helps remove LDL from your bloodstream. Soluble fiber, found in foods like oats, beans, and apples, binds to LDL in your digestive system, helping your body eliminate it more efficiently. This can lower your overall cholesterol levels over time. While fiber supports heart health, it's not a standalone solution. It works best as part of a balanced diet that includes fruits, vegetables, whole grains, and lean proteins. Diverticulosis occurs when small pouches form in the colon, often without symptoms. While most people with diverticulosis have no issues, some may develop diverticulitis when these pouches become inflamed or infected. Fiber plays a role here. Studies suggest that low fiber intake is linked to a higher risk of diverticulosis, possibly because it leads to harder stools and increased pressure in the colon. However, the exact relationship isn't fully understood, and more research is needed. If symptoms like pain or fever occur, medical evaluation is important. Lifestyle measures, such as increasing fiber gradually and staying hydrated, may support gut health, but they aren't a guarantee of prevention. Fiber isn't a magic fix for conditions like diverticulosis, where small pouches form in your colon, but it does help. Low fiber can make stools harder and increase pressure, which may raise risk over time. However, the exact link isn't fully clear yet, so research is ongoing. If you experience pain or fever, see a doctor. Small lifestyle tweaks like gradually adding more fiber and staying hydrated can support gut health, but they won't prevent issues on their own. Fiber helps digestion by adding bulk to stool, making it softer and easier to pass. But if you experience persistent bloating, severe constipation, or sudden changes in bowel habits, it may be time to seek medical advice. These symptoms could signal underlying conditions like irritable bowel syndrome, IBS, or diverticulitis. While fiber supports gut health, increasing intake too quickly can cause gas and cramps. Always consult a healthcare provider if you have concerns about your digestive system. Adding fiber too quickly can cause gas, bloating, or cramps because your gut needs time to adjust. Start with small amounts of high-fiber foods, like oats mixed with nuts, then gradually increase. This helps your digestive system adapt while supporting regular bowel movements. Always drink plenty of water and consult a doctor if issues persist. If you're new to adding more fiber to your diet, start slow. Aim to increase your intake by about 5 grams a day to avoid gas, bloating, or cramps. H1. Good sources include whole grains like oats or quinoa, nuts, seeds, and fruits with skin like apples or pears. Drink plenty of water, at least 8 cups a day, to help fiber move smoothly through your digestive system. If you notice persistent bloating, severe constipation, or sudden changes in bowel habits, check with a doctor to rule out conditions like IBS or diverticulitis. Fiber isn't just about digestion. It's part of a balanced diet that supports your whole body. Eating a variety of fiber-rich foods, like whole grains, nuts, and fruits, helps manage weight, keeps your heart healthy by lowering cholesterol, H4, and even supports gut health over time. Balance is key. Pair high-fiber foods with other nutrients for long-term benefits without moralizing. Always listen to your body and consult a doctor if you have concerns about digestion or heart health. While fiber has clear benefits for digestion and heart health, some long-term effects like its role in preventing conditions such as diverticulitis are still being studied. For example, while high-fiber diets may reduce the risk of diverticulosis, small pouches in the colon, research is ongoing about how much fiber is needed to see these benefits or whether it can help manage symptoms if they occur. Always consult a doctor if you experience persistent digestive issues, as some conditions require medical evaluation. Fiber is a plant-based nutrient that adds bulk to your diet, helping you feel full and supporting digestion without causing constipation when added gradually. It comes in 2 types: soluble, which dissolves in water, and insoluble, which doesn't. And both are important for heart health by lowering cholesterol and managing weight over time. While research shows high-fiber diets may reduce the risk of conditions like diverticulosis, more studies are needed to confirm exact benefits or long-term effects. Always listen to your body and consult a doctor if you experience persistent digestive issues, as some symptoms require medical evaluation. Remember, this is general health education, not personal medical advice. For individuals